Ready? Hello, ladies and gentlemen. Thank you for joining me today on this, I think, very eye-opening class on natural dental care without a dentist. Now, we're going to help you to learn to strengthen your teeth and avoid cavities. And this, of course, will help everybody, children, adults, and particularly people who are having, you know, uh, tooth pain, chronic gum inflammation, etc. And more important with your dental care is to be preventive because once you have a serious problem, it's going to be hard to avoid the dentist. So it's, prevention is the name of the game. My name's Khabir Southwick, Ayurvedic doctor and Ayurvedic herbal pharmacist in practice for 27 years and offering Zoom appointments worldwide and mailing my herbal products to my clients and patients worldwide. And all the products that I mentioned today are available on my website, herbmanteas.com, the sponsor of today's class. So we're going to cover, first of all, just kind of the misconceptions about making your teeth strong. Some of the common causes, you have to remember, I repeat this every single webinar. You always have to remove the cause. Most people don't like to do that. They'd rather just keep drinking the soda pop and then take the blood pressure or blood sugar medication or blood sugar herbs, or the alcoholic wants to keep drinking the beer, even though he's got alcoholic liver, and the person with fatty acid wants to keep having his hamburgers. But you have to identify the causes first. Remember this. I repeat it every time. In fact, I do whole classes on the causes of weight gain, the causes of some health condition, because that's the first treatment. So we're going to talk about the causes, and we're going to talk about diet and diets that can lead to degenerative teeth, because that's what we're talking about. Degenerative teeth. See, they can either become degenerative or inflamed, and that's the gums become inflamed. The teeth, which are similar to bone, so high in minerals, they can become degenerative. So it's kind of a degenerative bone condition. Then we're going to talk about nutrients, vitamins that can help after the diet. And then we'll talk about some little home remedies I'll throw in there as we go along. And then I have two powders, my Ayurvedic tooth powder. And I'm going to explain why tooth powders are so much better than using toothpaste. And then I have an anti-inflammatory oral powder too for conditions like gingivitis. So let's start with, the common kind of misunderstandings or mistakes people make that lead to this. You have to understand your teeth are basically very similar to bones. They just look like bones. So they have an enamel, which makes them a little unique, but they're basically need minerals and they need protein. And we could call those minerals, of course, like calcium and magnesium, etc. But it's a little bit more than just taking calcium supplements and magnesium supplements, because these supplements are isolated synthetic nutrients and they don't always translate directly into stronger bones in this case. And sometimes they're not easily absorbed because these vitamins, unless you're buying food-based vitamins, they are synthetic and isolated, so we really have to get it from our food. Now, the type of people that I've gotten that told me that they have pitting in their teeth, cracking in the teeth, and continually have cavities. Number one cause, of course, is just same thing everybody's been saying for probably 100 years, and that's sugar, not fruit. Fruit isn't going to give you cavities. I know that some people think fruit is now as bad as white processed sugar. No, we're talking cookies, candy, and of course, sticky candy like gum and sticky stuff that sticks on your teeth. Probably one of the worst things we can do. And of course, if you're taking antibiotics and not having healthy food, then you're not getting healthy bacteria. And we know the bacteria is part of the protection of our teeth. So, this is another risk we take when we take antibiotics, that we wipe out these healthy bacteria all over our body, and can take us months, and for some people even a year to recover. Even taking probiotics doesn't mean you're going to recover right away. But the biggest cause I saw over the decades of practice of people who came in And remember, when new patients come to me, they fill out a big questionnaire. And on the bones section, because we don't talk about medical conditions, we're treating the organs and systems in your body, not medical problems. So I'm asking questions about your bones, your muscles, your joints, your respiratory, your cardiovascular, your reproductive, etc. So under bones, it asks under the vata side, which means degenerative, cracking in the teeth, pitting in the teeth, and history of cavities. So it's all under vata bones. So what is vata? Vata means air, so it means basically a depletion. You're depleted. So if you have, and usually under the same area is hair loss. So and weak fingernails. It's another way we diagnose in Ayurveda the strength of your bones is by looking at your fingernails, feeling your fingernails. If they're splitting all the time, it's not a good sign. If they're splitting and breaking off, and or even just soft, if they're just soft but not splitting, this is a reflection of your bones. So there's many cases where I saw people's bones and I could see the deep ridges and I could see the splitting, and I would tell the patient, "Oh, your bones are degenerative. You're not consuming enough minerals in your diet to make your fingernails strong." And that's why you also check the box hair loss. But now I believe we have to support your bones before you have degenerative bones. And many people say, "Oh, I've already had a fracture. Already the doctor told me I had, osteopenia." So they haven't got the osteoarthritis yet, so it's not really bothering them. But they already know they have this degenerative bones, and the nails are brittle and splitting. They just don't know the connection. So we have a connection between the hair loss, which is the waste product. It's also made of minerals. That's why you can do a hair sample test and you can, find heavy metals, is because the hair is the waste. It's not alive. You can cut it. There's no pain. There's no nerves. But it is the waste product of your bones, according to Ayurveda. But, this jives in tests, because you can take a hair sample and you can find minerals, history of your minerals. It won't be what you took yesterday, but it'd be history. And that's how they do heavy metal tests, by taking a hair sample. So your hair is made also of similar ingredients as your bones and your nails. It's just the waste product. But even your fingernails aren't alive at the tip. You can snip them without pain. So we're talking about this tissue. In Ayurveda, we'd call this your ashtidatsu, your bone tissue, which is going to make up your fingernails, is like a sub-tissue, and your hair is like the waste. But they're all connected: bones, fingernails, teeth. Okay? So in Ayurveda, they're all bunched together, and we can diagnose this type of, and then of course you have vata, which is depleted, which I talked about, or pitta, which would mean there's inflammation. Nails would be all inflamed and pink, and at the cuticles, and maybe in hair would be coming out even more if it's inflamed. And the gums in the mouth could be inflamed. There could even be abscess in the mouth. So now we know there's pitta involved. But here we're talking first about this degenerative state of your bones. Means your hair's fallen, your nails are not strong, and you have a history of cracking or etc. Then this is what happened to many vegans. And vegans are very health conscious people. And that's good to have that attitude. But if you go read about Weston A. Price, he, was a dentist, I don't know, some quite 60, 70 years ago. And he traveled around the world to try to determine, what people had the best teeth. And he went around, looked at everybody's teeth, and then looked at what they ate. And he found out the ones that had the best teeth were having the milk and the dairy. So I think that's what happened to the vegans. So I always tell the vegans, you can probably get by without the meat as long as you replace it with beans. Beans is the best protein. I mean, greater percentage of the whole world, I think over 70% of the world gets all their protein from legumes, beans. It's only the wealthy people that get it, like the kings, and the people on the keto diet, they're eating a lot more meat and fat, and that's why they get the gout, King's disease. Too much protein has another problem, but too little protein has a different problem. So, so you can get your if you're vegan, you can become vegetarian, I would say. Just become vegetarian and eat your beans, you get your protein, and then but you add in at least the dairy. And if you say, "Oh, I can't digest milk. Oh, I can't have milk." Okay, just have some yogurt, have a little cheese, have a little butter. Everybody can eat butter. Nobody's having problems digesting butter. It's just the milk, and it's really not even milk is the problem. It's not the cow that's screwed up. It's, what we did to it, the pasteurizing, which took away the healthy bacteria that helps you digest it, homogenizing, which compressed it down molecularly, apparently, and makes it even harder to digest. So sometimes raw milk is much easier to digest. Warm milk is easier to digest. Goat milk is easier to digest. And goat milk is one of the most building, strengthening substances we could have. And Weston A. Price, traveling around the world, figured that out. And that's why if you get my bone building formula, you will see that it says take it in cow milk or goat milk. And then occasionally, every once in a while, people will buy the bone building formula and they'll say, well, I don't want to take it in goat milk or cow milk because I don't have, I don't drink dairy. So I email them back. How's your hair, your nails, your teeth? And I go, well, your hair, your nails, your teeth, your bones. How's your bones? And he goes, well, my bones are degenerative. That's why I'm buying your bone formula. And I go, well, the reason your bones are degenerative is, you're not having any dairy. And more than likely, a person not having dairy is probably having a very restrictive diet. So I kind of throw it back on them. You got to get rid of the cause first. So, and particularly children, and particularly when their teeth are growing, you need this. So let me throw in a few home remedies where you kind of got that point. Then we're going to go through the nutrition. Then I have this few products I want to show you. But home remedies, I would have everybody get a water pick. Water picks are the best for getting in all the cracks. And what I do is I put some neem powder in my water pick. You don't want to put oil in them. But, you can make a cup of like some neem tea or there's many things you could use that are, but neem is very good for the teeth because, it's anti-inflammatory and it's been used traditionally for the gums and the teeth. So I make a strong cup of neem tea, strain it off so it doesn't clog my water pick and just throw it in the water pick and brush it out and blast it out. I'll really only once a week, and you can get them very cheap, these little small water picks. I used to have one as a child. I had it for many decades where you put the water on the top and stuff like that. I don't know what happened to it, but now you can buy cheap little ones, kind of an individual one with a little battery in it. And I've gone through a couple of those. Things don't last like they used to. But I would have a water pick. I'd be using a water pick. And also I use a non-nylon tip tooth brush. I think the one I have now has got like coconut husk. So I'm not going to brush my teeth with plastic, just like I'm not going to wear polyester. I'm wearing 100% organic or maybe wool jacket, but I'm not going to wear plastic, and I'm surely not going to brush my teeth with plastic. And it's not easy to find a toothbrush that's not plastic, but you can Google it and you can find it. And I change mine up every few months. And it should be very soft, and you should brush your teeth only holding it in 2 fingers is what someone told me. Don't ever hold it like that, just 2 fingers. So you're not pressing too hard. And then the water pick, very, very effective, particularly for children who just aren't brushing well. And of course, we technically should be brushing once after every meal if you want to do it right. Now, if you have a cavity, you will have to brush every day. And if you have a cavity, you have to understand a cavity is like a pit in the tooth. It's not really a problem by itself. This is a very important point to make. And dentists have concurred with this. There's a book you can find called Drill, Fill, and Bill. Confessions of a Dentist. Drill, fill, and bill. So they're talking about how they over drill, over bill, for dentists. I've taken my son into a dentist, and he said when he was young, and he said like 8 teeth he wanted to work on. Well, we were going to India. I went to India. I saw an Indian doctor, and he only said 1 tooth is a problem, and he wouldn't even have to drill it. He was just going to kind of clean it out a little bit, and got a little drill in there and just kind of filled it with some ceramic, and that was it. And I didn't tell him the dentist in the United States wanted to do like 7 or 8 teeth. So definitely there, particularly if you've got good insurance. If you got no insurance, you're probably gonna not get it. Or you go to Mexico, they're probably not gonna drill and bill and fill you as much. But this is another problem. And once you drill that tooth, you're gonna wreck it for life. And then later on, the tooth's gonna fall out. You'll have to do a root canal, and then you're gonna have to do a cap. So every tooth you drill is going to be a lifetime business for the dentist business industry, because they're creating future problems. So you really want to avoid even just drilling your teeth out. And there's many books on natural dental care and things like this that repeat this information. So I really don't go to dentist. Haven't been, I don't know, 30 years or something. But I did have to learn a few things the hard way. And I'm going to share that with you. So, and diet is very important. Water pick, very helpful. And also a mouth wash. I have 2 things I do after I brush with my tooth powder, which I'm going to show you in a minute. But then I have this herbal Ayurvedic mouthwash, which I buy online. And but you can get different ones. If you type Ayurvedic mouthwash, you can find them. So I swish with that after I brush, and I'm always surprised after all my brushing, still little pieces of food come out just by swishing with this. Don't buy these ones with alcohol in it and stuff like that. No, herbal mouthwash. Someday I may make one, but I buy one for now. It's available online. And then after that, this is a very important point, because what we're talking about is strengthening your teeth and avoiding having to get the cavities to start this dangerous process of drilling. And then they fill it, and then that damages the tooth, and then you have to have the root canal later, and then you have to cap it. It wrecks the tooth. Just one cavity will wreck it. I'm missing a few teeth, and it's all from the cavities I got as a child. Every tooth I had as a cavity filled eventually went bad, and I just let it go. So I'm missing a few teeth. But here's the tip. This is very important. I'd write this down, folks. Oil pull with sesame oil, not coconut oil. That's what people do, coconut oil. Coconut oil, if your teeth are in pain or they're inflamed, you can do coconut oil. But particularly if there's burning pain in your mouth, okay, you can oil pull with coconut oil and spit it out. But if you want to make your teeth stronger, it's sesame oil. This is very important. So I've really given you the prevention methods right there, besides the diet we're going to talk about a little bit more. But the water pick, tooth powders, water pick, and you should, like I said, brush after every meal would be the perfect scenario. I don't do that. I brush in the morning. I brush in the evening. But it'd be better I went in there during lunch. I think sometimes I do go in there during lunch and give it a quick brush after I eat. But that would be the best scenario. It'd probably be the thing to teach your children and hope they do it. Brush after every meal, because the big problem is, if it's not the cavity that's per se the problem, it's if the infection forms. You guys must remember that. And even I've had dentists as patients, and they're not in a professional environment, so you generally can get the truth out of them. So I would say this: if you had a pit in your tooth, or even a cavity in the top, but it never became infected, would it be a problem? And they said, technically not, but it will become infected. So that's why we drill it and fill it, and then bill it. But there is ways, even if you have a cavity, even if you have a pit, to avoid the infection. And if you can avoid the infection, then you don't have to fill it. And if you keep oil pulling long enough with the sesame oil, you will rebuild the enamel in the teeth, plus the nutrients. You need the nutrients, the vitamins, the right diet, plus the oil pulling, and you can rebuild your enamel in the teeth. Slow going, but it does work. And I do provide my bone building formula when people want to go this route. But the whole secret is you can't have an infection. Once you have an infection, you have a pain. So I've had holes in my teeth, cavities in my teeth, never went to the dentist, because I'm going to show you how to fight this, avoid the infection. So then you just have the hole, and it's not the end of the world because it's not infected. Okay, so let's talk about a few nutrients that you need. Of course, just like your bones, you need the calcium. That's where all the milk is so helpful. And people think they can just take calcium supplements. Again, these are synthetic vitamins made in a laboratory, and they're called isolated. That means they only have like calcium citrate in it, just one type of calcium. And nowadays, I notice they're making magnesium using, three different types of, but it's still synthetic. It's not that's why the milk works so good. It's just naturally high in calcium. Milk and dairy and cheese is the easiest way. Particularly you have a growing child, growing teeth, let him have his cheese. He's craving it. Just because you're vegan, don't restrict your poor child who's growing and trying to grow his teeth and craves cheese. He's going to be sneaking around eating cheese behind your back. And then, of course, vitamin D. We know this helps absorb the calcium. But the problem is people are taking this D3, which is a synthetic, isolated vitamin made in a laboratory, and there was D1, D2, D3, and now they have D4. It's not natural. It's really you need it from the sunlight or animal protein, particularly fatty fish, so that's why you need the animal protein again, because that's a source of vitamin D. Another kind of a problem that a vegan will have, even though you could get enough sunlight. It's really a sunlight deficiency. I've spoke on this. And then there's phosphorus. This helps with building enamel. And of course, it's going to be found in meat, fish, eggs, and dairy. If you've noticed that. I mean, of course, the calcium we can get from dairy, leafy greens, and etc. And of course, they fortify a lot of milk with vitamin D because they knew about this problem. And then vitamin C kind of helps with the gums, particularly if you have gingivitis and things, and it helps reduce inflammation, like in citrus fruits and strawberries and bell peppers. That's only if there's inflammation in the gums. And then K2, which nobody used to talk about before. This really helps the D absorb in the bones. Now, I don't take these type of synthetic vitamins, and mostly this is found in fermented foods and animal protein again. And then there's magnesium, which helps with the tooth structure and helps regulate calcium levels. And this is found mostly in your nuts, your whole grains, and leafy greens. So if you're leaving out whole grains too, which is a new fad, grain-free diet, these people are going to be low in the magnesium and even some B vitamins. And then, of course, most important is protein. So if you're just having this low protein diet, which is, basically you're not having any animal protein, and you skip the cheese and you skip the beans, then you've skipped your three sources of protein that there are. So you really want to at least have the beans in there, maybe a little dairy to make sure you get healthy bones, healthy hair, healthy nails, and not not be weak, because low protein will make you very weak. And remember, protein is necessary for every cell. Every cell in your body is being made by protein. So, children, they need more protein. They're growing bones, they're growing muscle, they're growing, of course, that's why the weightlifter loves to eat just a lot of protein, and is because he's trying to grow muscles. So protein is essential, and a low protein diet from an extreme diet can really lead to inability to grow your teeth back, and weaker teeth that end up having more cavities and cracking. So I would do whole food supplements. Just go online and type food-based vitamin D, food-based magnesium. I've given many talks on whole food supplements. And, you want to do the oil pulling after you brush your teeth, just to review. You brush your teeth with a tooth powder, which I'm going to show you right now. And then you rinse with a herbal mouthwash, which you can buy online. Then you oil pull for a few minutes. I mean, I kind of do it till my jaw gets a little tired. And then you spit it out, and you can leave a bit of that oil in there. It creates like a film over your teeth. Best is at night, so there's a little oil in your mouth. So here I want to talk about, so those are the home remedies. That's the diet. Water pick, uh, oil pulling, number one, particularly if you've already got problems. I mean, I had cavities and pain, and I realized oil pulling really helped. Now, again, if you're in pain, you can use coconut oil. If you're being preventive, then you use um, sesame, not coconut. So here, let's take a look at my Khabir's famous tooth powder. Okay, I added in the word famous, but gently whitens teeth, removes plaque, and reduces sores, and it helps with oral inflammation, and it supports healthy gums. It really is a great product, and I think if people, it's what I give people mostly as a birthday present, like the first year you work for me and my company, when it becomes your birthday, I give you this the first year. And it lasts people like 6 months, and all the staff love it. Everybody you give it to loves it. And it usually will stop people from even wanting to use these fluoride infested uh, toothpaste. You should just skip that. The people have been using powders for centuries, centuries. Um, so powders have always been what's been used. The toothpaste is kind of like a modern phenomena to sell you something. And they used all kinds of things in the past, like salt, clay, different spices. So, clay is the base, and that's what's been used. But triphala is made of 3 herbs, triphala, 3 fruits, and it's known to be a little detoxing and cleansing and anti-inflammatory. And then there's cinnamon. There's neem, of course, anti-infection. There's a herb called kadir, not kabir, kadir, and this is for your gums. It's a special herb that's just used a lot of times in tooth powders traditionally. Licorice, soothing. Fennel, tasty. Sweet. Sandalwood, soothing. Little clove, fighting the infection. Cardamom, which this is probably the 3rd, maybe 4th version I've had, but the last version, I think it only had like 5-10% cardamom in it originally. And I just jacked it up to like 20%. Wow, it did wonders for the taste. Everybody loved it. And there's just a little black salt in there. And you don't really notice the salt. There it is, 1450. And it is really wonderful. And you can go read about each of the herbs here. It talks about them on the website. And it talks about even how to use it. You just dip your toothbrush, which should be a natural bristle toothbrush. I've had some even made of horse hair. I found, but mostly I'm made them from coconut husk. And of course, the handle isn't plastic; it's wood too. After a meal, you dip your wet toothbrush in this powder. I should have brought it. I just brushed my teeth with it right before I did this. And it doesn't taste bad at all. It tastes quite good. And then you just brush gently, and then you rinse. Very, very, very effective. I can't underestimate how valuable it is. It lasts for months. It tastes good, and it's much, much better than toothpaste. And again, that is available on herbmanteas.com. And if you have a coupon code or something, it'd be even cheaper. So let me look at the other product here. This one is I made for inflammation. In fact, I made this one first. I worked on these for years because you can buy Ayurvedic tooth powders. I mean, the other one's this one is for cavities and gingivitis, mouth ulcers, and abscess. So this is the oral infection powder or oral anti-inflammatory powder. And it's amazing. I mean, this is the one that stopped so many people from even going to the dentist or going to get the gingivitis. And it's very interesting. It's got the charcoal in it. So this one's black. You can just start to see it here. It's black. And that charcoal, when you brush your teeth in that, it just absorbs all the toxins. And it gives you, it's amazing how fast the relief is, even from a toothache. So I've had people coming to the appointments with the tooth pain. I gave them this, and they never went to the dentist. They just kept brushing with it. I mean, they didn't want to go to the dentist. Who wants to go to the dentist? And I know people that say they're still brushing with it and still buying it. So charcoal is very, very important. And they used to brush their teeth with charcoal. It's well known. And there's the bentonite clay again. There's the neem. Now there's more neem in this one. This one doesn't taste as good because it's more therapeutic. But it definitely reduces the inflammation in the gums, and even prevents infection in your cavities. So the cavity in itself is not the problem. It's if it gets infected. So that's why you got to keep it really clean. Once you have a cavity, you got to brush your teeth like every day and water pick every day, because any little speck of food gets in that little pit or cavity, it's going to hurt. So you just have to, like, every meal, clean it out, clean it out. I did it for months and months and months. And then, I start consuming more dairy, and then that would firm up and make my tooth stronger. And I would take this oral infection powder. I made this oral infection powder while I was in extreme pain. So I kept adjusting it until my pain went away. So this formula was built on my pain. I hope that helps you. And there's the Khabir again. This is an herb well known to be good for the gums. There's a little cinnamon, there's a little licorice, and then clove, which is also viral. And also helps with the pain. It's just amazingly effective. And you should just keep taking it. It talks about some of these herbs here. It tells you how it stops tooth and gum infections naturally, relieves toothaches and oral nerve pain, reduces gum swelling, bleeding, and irritation, cleans teeth, removes plaque, freshens breath. I mean, it's unbelievable. A safe alternative to chemical dental care, helps avoid evasive dental procedures when used consistently. And I don't use this one all the time because I don't have any pain, because I started eating more dairy and got my diet better. And then my teeth became strong. My enamel became strong. My fingernails became like hard as rocks, and my hair stopped falling out. So I don't use this one anymore. But when I had the pain, when I was admittedly on a little bit more restrictive diet, then this is what I used every day. But I know people that say they only brush with this one. Personally, I brush with the tooth powder now, which is more preventive, and still has the neem. So you're keeping infection at bay. You're keeping unhealthy bacteria at bay, and it tastes good, and you get the fresh breath, and it's still more kid-friendly there. See, took a picture outside of my backyard. So, and the other one, if you really have a degenerative bone condition, you got cracking nails, hair falling out, then you can get a bone building tonic. So this is high in natural sources of calcium, not synthetic, and minerals for bone fractures. In fact, if you look at the ingredients, there is what's called Ashti Shringala is the first ingredient, and Ashti in Ayurveda means bones. So this herb, Ashti Shringala, is only used for strengthening your bones. You can see it in osteopenia formula, osteoarthritis formula. You go to any Ayurvedic doctor anywhere in India and say, hey, I got osteopenia, degenerative bones. He's going to give you probably Ashti Shringala all by itself. But there's other herbs that can be taken with it. And that's what we have here, is more of a formula. The next important one to build your bones and your teeth strong is Pravalpishti, which is basically coral. They call it coral calcium, but Pravalpishti is the coral, and then they treat it. They boil it in a bunch of herbs and let it dry, and they boil it in herbs and let it dry, so it's more absorbable than just the coral by itself. But everybody knows coral's high in calcium, and they've been taking this for centuries as well. And then there's Arjuna, which is just a wonderful herb used for so many things. Moringa, which became a fad for a little while, because it's so nutritious. We only use it really in cholesterol, treatments. It's very hot, very spicy, but when we just want some good nutritional bang for the money buck, we throw a little moringa in there, and that's what we want when it comes to building bones. We need nutrition, so that's why moringa's here. But a lot of people are taking moringa and don't need it. They just don't know what it's for. Bala means strength. That's what bala means. So it's a building, strengthening oil. Herb. Dasha mula. Dasha means 10. Mula means roots. So the roots have the minerals in them, like carrots, sweet potatoes, beets. The roots. That's where the highest concentration of minerals are. So you're taking 10 roots here. It's just an anti-inflammatory. It's used in Ayurveda. Dasha mula is anti-inflammatory. and building and strengthening you, particularly for the bones. A little ginger just to help you digest it because it's a heavy formula, particularly you got pure coral powder in there. And so you need a little ginger to even help you digest it. And this supports bone regeneration, recovery from fractures. It increased the bone density with bioavailable calcium, not your calcium citrate from the supermarket. Helps with joints and connective tissue. Of course, it balances Vata dosha because Vata dosha is the sign of depletion in this sense, and it helps with overall calcium absorption when taken with fat. So you have to take it with fat. You need fat. We have other products like bone building tabs too, but this is a resin from a tree that's been used traditionally to build bones, and it just comes in these little black herbal balls here, and it says laksha, but it's actually lakshadi gugulu. It's just separated here, but in Ayurveda we call it lakshadi gugulu. Gugulu is a type of black resin, and lakshadi is this type of resin. So there's an herb. It's just known to strengthen bones, and Harjud is another name from Ashti Shringala. And then Arjuna you saw in the other formula. And so there's Maga Bala. See, the word Bala means strengthening. This is a traditional formula product. We have to import it, but it's for low bone density and osteoporosis and osteoarthritis. It's going to help more with the pain than just the bone building formula. So I hope that give you some ideas of what you need to do to, one, avoid cavities, which is eat a broad, full diet, no restrictive diets, and get some sunlight. So you're getting your natural source of vitamin D and not just rely on synthetic vitamins. Never take, and if you're a thin person, a lot of fasting. Too many people think fasting's a cure-all. Well, if your hair's falling out, you have degenerative bones and your nails are cracking, you're already nutritionally deficient. So the last thing you want to do is fasting. But people do fasting when they're depleted, not realizing they're just going to become more depleted. And if you just eat salads and smoothies all the time, you're going to be very depleted as well. So you have to have a full, balanced diet. And if you're having teeth, hair, and nail problem, then you should definitely be having more animal protein. Particularly dairy is the most effective. And I would look up Weston A. Price, who did a lot of research on this and really changed my view. And I think he is correct. But Ayurveda says the same thing. It's the dairy that builds the teeth and the bones. So change the diet, get the water pick, get some tooth powder from me, and get some herbal mouthwash, get some sesame oil, and just add these into your routine because your teeth are so important and they can really be painful and costly to have problems later in life. So the more you do now to prevent, the best. And even if you have the pain and it's not too bad, you don't have like an abscess and there's no choice, you're just feeling a little pain, then you can try to do these things that I said, the water pick, the tooth powder, the oral infection one, of course, if you have the pain, some more dairy to strengthen up your teeth. And you can, as long as you can keep that pain away and keep any food particles from getting stuck in that cavity, you could do what I did and actually recover and have your tooth grow back slowly and never have to go to the dentist. But it takes persistence and consistency and self-discipline to do it because it's a lot more than just brushing your teeth. And believe me, I was brushing my teeth after every meal for months and months, maybe even years, until I got this tooth powder to stop. And I would brush it with this powder to stop the infection. But it was when I changed the diet and not relied on supplements and just started doing the dairy, particularly the milk. When I just started drinking milk, I noticed within a month a difference in my nails, my hair. But I get the raw milk. Raw milk is very, very important. And goat milk's even better. And I have had in the past sources of goat milk. I don't have one now, but I've had sources where I can get the raw goat milk. That's the best, easier to digest. So I hope that helped you. Hope that helped you realize that you need to learn to take care of your own teeth and not rely on just going to the dentist because they are going to drill, fill, and bill. And this is going to create a long history of more dental problems. Every time they drill, they're shaking the roots or damaging the roots. And this is going to create a problem in the future. And you're going to have the whole tooth drilled out and capped and even replaced later on in life. So you want to avoid cavities. Or if you do have them, treat them in the early stages with some of the guidelines I gave you. All right, folks, I hope that helped inspired you. I mean, not my expertise treating dental problems. Sharing you mostly my personal experience. It's not my profession. But I have helped a lot of people, particularly with the gingivitis and that formula. And of course, if you're having inflammation in your gums are muscle holding your teeth there. You could see your teeth are like bones with enamel, and your gums are muscles holding them. So if your gums are inflamed, you have muscle inflammation. So a lot of times for those people, they have inflammation throughout their whole body. So I'll give them anti-inflammatory herbs for gingivitis plus that formula. Okay. So gingivitis, if there's inflammation and pain, and if you've got an abscess, then I'm going to give you something for infection. I have an infection formula. So, if you had an abscess, I'd give you an infection formula. If it was inflamed, I'd give you an anti-inflammatory, and I would change your diet, and I would give you that tooth powder. Okay. Sometimes has to be a complete, holistic treatment, not just one little product's going to solve your problem. All right, ladies and gentlemen, thank you very much. Don't hesitate to contact me or my office and schedule a Zoom appointment if you'd like to just have me help you with your health conditions, including building your bones, your nails, and your hair. All right. Thank you very much, ladies and gentlemen.